We certainly have issues. I mean, the drugs that we use are extraordinarily expensive. I mean, both bortezomib and lenalidomide are, $8,000 a month drugs. So these are serious issues. For the most part, even when patients can't afford our drugs, we can get them from the manufacturers, that they have wonderful patient assistance programs. So in terms of having a specific impact on individual patients, it happens, but rarely. The more global question is the cost of these drugs preventing us from developing other drugs and excluding other drugs from the marketplace. I mean, that's more of a social and political question, and Dr. Pecora is certainly much better equipped to answer those kind of questions than I am. I mean, for me and my patient population, it's less intrusive because we spend so much of our time doing clinical research. I mean, most of the drugs that we're using, patients aren't paying for because they're being provided as part of the clinical trials, and we, more than anybody in the cancer center, put our patients on clinical trials. So it's obviously an issue. It isn't so much a personal issue at this point, although I certainly see it becoming more and more of a personal issue as we have more and more pressures to limit costs. But a good way to limit costs is to have patients participate in clinical trials where the cost of those drugs is borne by the sponsors of the clinical trials rather than the patients or their insurance companies, providers.